Next, we'll talk for a minute about a non-surgical option that's relatively new in the United States, the gastric balloon. There are actually 3 gastric balloons now that are approved in the U.S., which I'm sure more to follow. But the first one that was approved was the Orbera gastric balloon, which is just a single large saline-filled balloon. And then the next one was the ReShape Duo, which is kind of a unique design with 2 smaller side-by-side balloons, and it sort of looks like a dumbbell. The advantages of a gastric balloon is that for patients who are self-pay, it's going to be more affordable than a surgical procedure. Even though the risk of the surgical procedures are very low, the risk of a gastric balloon will be even lower because it's not an operation. Gastric balloons are reversible. In fact, they're designed to only remain in the stomach for 6 months after surgery. On the downside, the power of a gastric balloon is significantly less than surgical procedures, and typically we're limited to somewhere around 30 to 50 pounds of weight loss with a gastric balloon. Another disadvantage is that gastric balloon patients can have some nausea and vomiting issues, especially at first after insertion of the gastric balloon. And then obviously once we remove the balloon, it's going to be harder to maintain the weight that was lost than it would be with a permanent option such as a gastric sleeve. And before we finish this section, I just want to talk briefly about something that I call combination therapy. Our practice has a unique experience with both surgical and medical weight loss, so we have the ability to combine these 2 therapies to achieve better results than a patient would potentially see with just one or the other. I like to think of obesity as a cancer. It's a progressive disease that can require both surgical and medical treatment. And we have experience in our practice with many appetite suppressants and chronic weight management drugs. There's the old standby phentermine or Adipex that's approved for short-term use. And then there are several newer medications that are approved by the FDA for long-term weight management. So we can help patients who are years out from surgery who maybe need a little extra stimulus to get some additional weight loss or prevent them from seeing weight regain. So we have many options for patients to help them stay on track after surgery and to get down to their goal weight.